let's learn all about multiple sclerosis or MS. Multiple sclerosis is an autoimmune disease. It is caused when the immune system attacks the protective sheath called myelin of nerves, which causes breakdown of this protective sheath. It is likely caused by a combination of genetic and environmental factors, and onset is often between 20 and 40 years of age. Risk factors for multiple sclerosis includes being female, having a family history of multiple sclerosis or other autoimmune diseases, infections with viruses like Epstein-Barr virus, being fair-skinned, living in areas with temperate climates like the United States, having low vitamin D levels, being overweight or obese, if you have other autoimmune diseases, and if you have a non-ideal gut microbiome. It is unknown why multiple sclerosis occurs, but multiple sclerosis is seen more often in people with these conditions. The signs and symptoms of multiple sclerosis includes numbness and tingling, electric shock sensations, a lack of coordination, trouble walking, weakness, vision loss, specifically with pain during eye movements, double vision, blurry vision, dizziness, sexual, bladder, and bowel dysfunction, as well as fatigue, slurred speech, difficulty with memory, thinking and understanding, and even anxiety, depression, or mood swings. There are a couple different types of MS, the most common being relapsing remitting type, where you experience periods of new symptoms or relapses, which can last for days or even weeks, followed by periods of remission or minimal symptoms lasting for months or years. This pattern repeats. The second is secondary progressive. About 20 to 40% of people with relapsing remitting version will develop this version of MS. It often happens within 10 to 40 years following the onset of MS. It is characterized by worsening of symptoms causing difficulty walking and mobility and may or may not have the remission periods. The third type is primary progressive, which has a more gradual onset and has steady progression of symptoms. It does not include remissions or relapses. It has continuous symptoms. Another couple of terms to include is clinically isolated syndrome, which is the first episode of a condition that affects the myelin sheath, and radiologically isolated syndrome, which is findings on an MRI scan of the brain and spinal cord, which shows the damage to the nerves. The treatments for MS are relatively new, and there is not a lot being done currently, though research is continuing to improve. The treatments currently being used for MS is disease-modifying therapy, immunosuppressants, stem cell transplants, and physical, occupational, and speech therapies. Some complications that can occur due to multiple sclerosis is muscle stiffness or spasms, seizures, severe weakness or paralysis, and even dementia. Multiple sclerosis is a hard condition that can greatly impact overall quality of life. Thank you for learning about MS with me.